Keratoconus is a very important eye condition, and many of us have heard about it before. But unfortunately, most people still know very little about what it really is. In today's episode on OctopusPharmacist Ophthalmology, we will talk about eye diseases in a simple, clear, and reliable way. We'll explore what keratoconus actually means, how it develops, what symptoms appear as it progresses, and what stages a disease goes through. We'll also understand the risks of leaving it untreated. And finally, learn about the newest and most effective treatment options available today. Stay tuned. This episode will open your eyes to something truly important. Peace be upon you. I'm Hussein Lotfi, and you're watching the Octopus Pharmacist channel. Welcome to a new episode of Octopus Pharmacist Ophthalmology, where we explore fascinating topics about eye health and vision care. Today's episode has a very special title. We'll be talking about keratoconus. If you want to understand everything about this condition, from start to finish, stay with me until the very last minute. As always, let's begin by understanding the topic deeply and seeing why it's so important. We'll first get to know the main part of the eye in a simple, clear way, because when you understand how the eye works, you'll understand how diseases like keratoconus begin. Think of the eye like a high-precision camera. Each part has a role that helps capture sharp, clear images, which the brain then translates into what we actually see. This process only works properly when every part of the eye is healthy and clean. The outer white layer of the eye is called the sclera. It's the tough, protective coating that surrounds most of the eyeball, giving it shape and safeguarding the delicate internal structures. The sclera covers everything except the front transparent part, the cornea. Next comes the choroid, a layer rich in tiny blood vessels. Its main job is to deliver oxygen and nutrients to the retina, the light-sensitive layer that captures images. Now, let's talk about the pupil, the dark, circular opening in the center of the colored part of your eye, called the iris. The pupil controls how much light enters the eye. It widens in dim lighting to let in more light, and narrows when it's bright to protect your retina from excessive light exposure. The iris, which gives your eyes a unique color, is made up of tiny muscles. These muscles adjust the pupil's size and help control the light balance reaching the back of the eye. The color of your eyes depends on the amount of pigment, called melanin, in the iris. Now, here's the star of today's episode, the cornea. This is a transparent, dome-shaped front part of the eye that covers both the iris and the pupil. It plays a major role in focusing light onto the retina. The cornea doesn't contain any blood vessels because transparency is vital for vision. Instead, it gets oxygen and nutrients from tears and from the clear fluid inside the eye, known as the aqueous humor. For light to pass properly, the cornea must stay smooth, clear, and evenly curved. If its surface becomes irregular, as happens in keratoconus, light scatters and vision becomes distorted or blurry. Think of the cornea as the lens cover of a camera. If it becomes misshaped or cloudy, the image will never be clear. This is precisely what we'll explore later when we talk in detail about keratoconus. Next, we have a thin, transparent membrane called the conjunctiva. It lines the inside of the eyelids and covers the white part of the eye. It helps protect the eye from dust, infection, and dryness, and connects the different outer layers together. Behind the cornea lies the lens, another crucial component that focuses incoming light right onto the retina. It's flexible and changes shape thanks to tiny muscles known as the ciliary muscles, helping you switch focus between near and distant objects. The lens is made largely of proteins arranged in a clear, gel-like pattern. When these proteins clump or lose their transparency, the lens becomes cloudy, a condition known as cataract, which can seriously affect vision. Finally, we reach the most vital part of the eye, the retina. This thin layer contains specialized cells called photoreceptors, divided into two main types, rods and cones. Rods help you see in dim light and recognize shapes and motion, while cones detect color and fine details under brighter light. The retina converts light into electrical signals, which travel through the optic nerve straight to the brain. There, the brain interprets these signals and turns them into the images you see. And that's a quick, clear overview of how the eye works, each part playing its role like a fine-tuned camera. In our next part, we'll dive deeper into keratoconus, how it develops, what symptoms to look for, and what modern treatments can help restore clear vision. Stay tuned to learn something new about your eyes, right here on the Octopus Pharmacist channel. After our short introduction about the parts of the eye, let's now get to know a very important condition, keratoconus, which is sometimes called corneal cone because of how the cornea changes shape. Normally, the cornea should be smooth, round, and shaped like half of a sphere. Its regular curvature helps light pass through evenly and focuses clearly on the retina. But in keratoconus, this perfect round shape becomes distorted. The cornea starts to thin gradually and bulge forward into a cone-like shape, which makes vision blurry and distorted. When the cornea loses its normal shape, light rays entering the eye no longer focus correctly. This leads to problems such as nearsightedness, irregular astigmatism, and sensitivity to light. Think of it like a camera lens that becomes uneven. The image will never look sharp again. So, what causes this change in the cornea's shape? The main structural part of the cornea is made of collagen fibers. These fibers act like strong cables that keep the cornea firm, smooth, and stable. In people with keratoconus, these collagen fibers become weaker or less connected. This loss of strength allows internal pressure of the eye to push the cornea outward, giving it that cone-like bulge. This process often begins in the teenage years or early adulthood, then progresses slowly over time. As the condition develops, vision becomes more unstable. Glasses may stop giving a clear image because the cornea's shape keeps changing. But why does collagen become weak in the first place? Doctors still don't know one single cause, but research suggests several main factors. The most common is genetic inheritance. Keratoconus often runs in families. Other possible causes include chronic eye rubbing, which can damage corneal tissue, and recurrent allergies or inflammation, which weaken the cornea over time. Sometimes oxidative stress, the imbalance between free radicals and antioxidants, also contributes to corneal thinning. So, eye rubbing doesn't cause keratoconus by itself, but it can make the condition progress much faster and worsen the deformation. Now, how can someone know if they might have keratoconus? The symptoms usually appear gradually. The first sign is seeing halos or starlight glows around lights, especially at night. Then, vision becomes blurry or double, even with glasses or contact lenses. There may also be increased sensitivity to bright light and occasional eye redness or discomfort. Some people experience frequent changes in their eyeglass prescription. That's another early warning sign. If any of these symptoms appear, an eye specialist should be visited immediately. Only a precise examination can confirm whether it's keratoconus or another eye condition. Understanding the cornea and how it changes is the first step in protecting your vision. In the next part, we'll discuss the stages of the disease and how it can be treated with the latest medical techniques. Stay tuned. Your vision deserves care and attention. Now, let's move to the third and final part of today's episode. And honestly, it's the most important one for all of us. We're going to talk about the treatment steps for keratoconus, or what some call the cone-shaped cornea. Doctors classify keratoconus into three main stages: mild, moderate, and advanced. Each stage requires a different treatment approach, and the doctor decides which one is best based on how much the cornea has changed in shape and thickness. Let's start with the first stage, the mild form. Here, the main goal is to keep vision clear and prevent the disease from progressing. In this early phase, the doctor may prescribe eyeglasses or special contact lenses. But these lenses aren't the regular ones used for simple vision correction. Some are specifically designed to reshape the cornea slightly and improve how light focuses on the retina. This helps restore clearer vision and can even reduce irregular astigmatism. There are several types of lenses that doctors might choose from, depending on the individual case. Piggyback lenses, which combine a soft contact lens under a rigid one. Hybrid lenses, with a hard center and soft edges for comfort. Rigid gas-permeable lenses, which help smooth the corneal surface. and scleral lenses, which rest on the white part of the eye and vault over the cornea, providing excellent vision and comfort. When the disease progresses beyond this stage, we reach the second or moderate stage of keratoconus. Here, the preferred treatment is usually a procedure called corneal crosslinking, also known as CXL or corneal strengthening. It's a quick, minimally invasive procedure, usually done in a clinic rather than a hospital, and it takes around 30 minutes. The idea is simple. After numbing the eye, the doctor places riboflavin drops, a form of vitamin B2, onto the cornea, then exposes it to a controlled ultraviolet A UVA light. This light activates the riboflavin and triggers a natural chemical reaction that binds the collagen fibers more tightly together. As a result, the cornea becomes stronger and more stable, greatly reducing the risk of further bulging. Although cross-linking doesn't completely reverse keratoconus or return the cornea to its original shape, it successfully stops the disease from getting worse in most cases. Patients usually begin to see measurable improvement in about 3 to 12 months. Now, if the condition reaches its third stage, the advanced level, vision becomes severely blurred and contact lenses often no longer fit comfortably. At this point, doctors may consider one of several surgical options to restore clearer sight. The first of these is called intrastromal corneal ring segments, commonly known as INTACs. During this minor procedure, the doctor makes a tiny tunnel in the cornea and inserts two thin, curved plastic rings shaped like the letter C. These rings gently flatten and stabilize the cornea, allowing light to focus more accurately. The INTACs procedure takes roughly 15 minutes and is usually painless. Patients often notice improved comfort when wearing contact lenses afterward, and the great advantage is that the rings can be removed or replaced later if needed. Another option for more advanced cases is called partial corneal transplantation, specifically deep anterior lamellar keratoplasty, or DLK. In this surgery, only the damaged layers of the cornea are replaced with healthy donor tissue, leaving the patient's inner corneal layer intact. This method helps restore the strength and clarity of the cornea while lowering the risk of rejection compared to a full transplant. And finally, in the most severe cases, when none of the previous treatments are effective, a full corneal transplant, known as penetrating keratoplasty, becomes necessary. This involves replacing the entire corneal tissue with that from a donor. The surgery usually takes about 1 hour. After the transplant, most patients experience significant improvement in their vision within 3 to 6 months. However, because the new cornea comes from another person, it's vital to use doctor-prescribed medications to prevent tissue rejection. No matter which treatment option is chosen, one essential step follows all of them: wearing the correct glasses or contact lenses afterward. This ensures clear, stable vision and protects the results of the treatment. And that brings us to the end of today's episode from OctopusPharmacist Ophthalmology. I truly hope you found this information valuable and learned something new about protecting your eyes and improving your sight. If you enjoyed this episode, don't forget to like, subscribe, and share it with your friends. And if you'd like to support the channel, you can do so through Patreon, PayPal, or directly here on YouTube. Thank you for watching, and as always, take good care of your eyes, because vision is one of life's greatest blessings.